I love this field, hip and knee reconstruction and doing hip and knee replacements, managing arthritis. I get to treat a multitude of patients in the middle-aged patients, as well as patients who are elderly, have severe arthritis. I mean, usually for something like this, I would start off with an injection, anti-inflammatory exercise program. You have the brace, and we'll see how you do.
Absolutely, I'm very satisfied with Dr. Palumbo. He's rated very, very highly, and he says he does 250 to 300 a year. He's pretty skilled.
It starts to hurt. I used to take an anti-inflammatory, baby it. Little burn.
See, boys, there's nothing to it. Well, I think Dr. Palumbo's a great doctor. I feel very comfortable, at ease with him, I would send anybody to Dr. Palumbo. I've already told a few people about him.
So I think the plan, we're going to try an injections and therapy. If it's not getting better, we'll get an MRI. We are passionate about what we do. We care about the patients. It's really my team's goal to make sure that the patient, that they're happy with the outcome that they've achieved, and that they would do it again themselves or recommend their family.
Everything looks good. I mean, you can see your hips, like they're mirror images of each other. We'll just do the 1-year follow-up for this one.
He's terrific. He listens to you. He explains things very well. I couldn't agree with him more.
We care greatly about what we do. We want to do an exceptional job to help those patients get back to their normal life. You have a whole team here just waiting to help you.